When they're little, you can't get them to sleep. When they're teens, you can't get them out of bed. And food? Well, that's a whole other battlefield. But what if I told you, like I tell my kids, that sleep and nutrition are actually secret weapons for better moods, stronger focus, and even lowering the risk of substance use? In this episode, we'll show you how small, realistic changes at home can make a big difference. And we'll bust some myths along the way. I'm Jodie Sweetin, and this is Awkward Conversations, where each week we give parents real-world tools and expert advice to help their kids make smart, healthy choices. So grab a snack, preferably a healthy one, and stick with us, because this is one episode you can't afford to sleep through. Welcome back to Awkward Conversations, and welcome to Season 5. And I'd love to introduce my amazing co-host, Amy McCarthy, who is a senior clinical social worker at Boston Children's Hospital in the Division of Addiction Medicine. Thank you so much, Amy.
Pleasure to be here as always. Thanks so much, Jodie. I'm excited to welcome Dr. Jason Kilmer. He's a professor of psychiatry and behavioral sciences at the University of Washington School of Medicine. For more than 25 years, he's been a part of research on how substance use and mental health intersect, and has helped explore ways in which parents can use these insights to help reduce substance use risk for their kids. Hi, Dr. Kilmer. Welcome to the show.
Hey, thank you, and fun to be here today.
Also joining us is Maya Feller, a nationally recognized registered dietitian nutritionist and founder of Maya Feller Nutrition. She's known for her approachable, inclusive style of nutrition counseling, and she's passionate about helping families build balanced eating habits that support better sleep, mental health, and overall well-being. Hi, Maya. Thanks for being here.
So glad to be here.
Glad to have you.
And we're joined by Caitlin Merlot, a public health advisor with the CDC's Division of Adolescent and School Health. She specializes in how schools and communities can support healthier lifestyles for children and adolescents, including strategies around nutrition that parents can use at home. Hi, Caitlin.
Hi, it's wonderful to be with you all today.
Well, this is, I feel like, an episode. I have teenagers that are 17 and 15 that I can especially use. The sleep, how do we get it to happen? How do we get him to eat healthy snacks? All of that kind of stuff. I'm just really excited to have you all here. And according to the CDC and NIDA, poor mental well-being in youth significantly increases the likelihood of engaging in risky behaviors, including substance use. In fact, studies show that adolescents experiencing symptoms of depression or anxiety are up to twice as likely to experiment with drugs or alcohol compared to their peers. Now, while none of you specialize directly in substance use, you are experts in sleep and nutrition, which are two critical factors that have a huge impact on mental health. So we'd love to hear your thoughts on how sleep and nutrition are all connected to mental health, mental well-being, physical well-being, and prevention of substance use.
Well, the majority of my work is around substance use and largely with college students, though we do work with young adults in general and even high school students, things like this. And I mean, you said it really well. These are all very, very interconnected. Decisions people make about substance use can impact mental health, including choosing to not use at all.
That resonates so much. We see the same in our practice with kids, especially around their substance use, but also how and when they eat in relation to substance use, and then how that impacts their sleep-wake cycles and then their next day choices. And it's so interesting, especially with like that tween teen population, when they're not well nourished, specifically with nutrient dense foods that are feeding them on a cellular level, they tend to have these like really big highs and lows throughout the day. And then especially if they're using substances, it's like further compounded, and the outcomes can be so negative.
And lack of sleep is often, a reason for young people to initiate using substances. They find, they maybe experimented, they find now it does feel like it's helping me sleep, or it's, or I don't want to sleep. And so, and we talk to our young people all the time about the research does show that, at least with cannabis use, they say, well, I fall asleep much easier, but the quality of their sleep overall is not great, which is why they wake up and, they're exhausted. So that cycle just repeats itself over and over again and just kind of gets them in an endless loop. It's fascinating also to think about how, young people need on average 8 to 10 hours of sleep a night. And if young people are getting less than 6 hours, the likelihood that they engage in substance use within a year skyrockets. And so really being able to pay attention to, if your child is really struggling with sleep, of course that has to get addressed, but that there also might be some secondary impacts with substance use overall.
I mean, you summed up really well. There's a big difference between falling asleep more quickly and then what happens to quality of sleep. Rapid eye movement sleep, or REM sleep, where we do our dreaming, when people have a positive blood alcohol level, they fall asleep faster because alcohol depresses or slows down the central nervous system, but they don't get that REM sleep.
Right.
And so the impact of REM deprived sleep is the next day increases in anxiety, daytime sleepiness, irritability, depending on what's going on with a friend, a family member, increase in jumpiness. With cannabis, you said it perfectly, onset more rapid. Here we hear people say, if I use it at night, I feel like I sleep hard and don't dream. It's because they have that same REM deprivation.
That's what can make withdrawal so difficult too. So preparing young people for those changes that might be coming as they try to, exit those substances out of their body is, super important so that they don't get there and they say, I'm not doing this. I'm going
Right.
back. I'm going back because that's better. There's
Right. And detoxing from any substance we know is always disrupts sleep. It's always
Right.
very difficult. So as much as it has been, quote unquote, thinking that it's helping you, it's going to lead to a really, really hard way to undo it. Now, speaking of things that are connected, sleep and nutrition are so connected and often influence each other.
My research at CDC doesn't focus specifically around sleep and nutrition and that link. But I think when we're talking about adolescence, one thing that's really important to consider is caffeine consumption, because we know that drinking caffeine late in the day, that can interfere with our sleep cycles. And then that can create sort of a vicious loop where you're compensating for poor sleep by having more caffeine the next day and so forth and so on.
And I think that, at least in the young people I talk to, people think of caffeine as a pretty benign substance in general. Like, everyone's drinking coffee, everyone's got their, energy
Right.
drinks, and they aren't necessarily in tune with how that's, overall impacting their lives.
Right.
And
And
their bodies.
oftentimes drinking energy drinks curbs your appetite. The caffeine lowers your appetite and the sugar spikes your blood sugar. So now you're going up like this, except now you have no food to feed your brain. And then you come down like it's, that roller coaster of emotions, which I don't think any teens or tweens need help with. It's happening enough for them. What are some thoughts about nutrition, about how we can maybe lead our kids, to eating healthier, better foods, model that for them? What if they just absolutely refuse to eat it? Like, how do we work with young kids who are trying, or young people who are trying to assert their autonomy in what they want to eat and are probably eating too many Takis?
I have to say that if I could go after the Takis, that could be my entire mission in life.
I could, yeah. I'm with you on that
I
one, Maya.
mean,
I'll be your.
the list is long.
I'm
The
with you on
list
it.
is long.
Yeah.
Takis in moderation.
Oh, totally. You know what? From the gentle nutrition perspective, 100% Takis in moderation. The challenge with youth is that, especially when they're in school, and this is something that I see when I'm working with kids, is that meal times in schools you can have lunch at 10 a.m., which could be brunch, absolutely not lunch. And then you're there until 4 or 5. And so that's when the Takis come in. But seriously,
I know my kids
When we're-
oh, sorry, I didn't mean to interrupt, but I know my kids are also weird about eating at school. Like, they're weird about eating in front of their friends. It's a strange behavior, but apparently eating is weird. I don't know, but
the anxiety.
But it is the anxiety. What if something's on my face? What if I look stupid? I look dumb chewing. What if it gets stuck in my braces? I know my kids have really struggled with that. I'm like, why don't you eat? They're like, it's weird.
it is totally weird. And it's also, there is a culture around eating that even we as adults it's just implicit, and our kids pick up on it. And I see this a lot when we're talking about modeling positive food related behaviors in home settings. Schools are not like that. For kids who have any sort of sensitivity, lunchrooms are a minefield. They are loud, they are filled with a bunch of smells, and it's supercharged energy. So I totally get why many kids are like, you know what, just going to skip it. But in terms of the home environment, what I often say to families, and this is a hard thing for people to really hold on to because they're like, oh my gosh, what if my kids don't eat? I say, like Ellen Satter said, the adults decide what, where, and when, and the kids decide if and how much. And then there's always a time when kids start to join into whatever the decisions are around mealtime. But in theory, we should be creating an environment where there's a variety of foods that are available, ideally in their whole and minimally processed form with minimal added sugars, fats, and salts. I have to say that because I'm a dietitian. And, right, also some sweet things, and also some Takis, right? So no food is totally off the table, but the center of the culture and the family eating is really based in whole and minimally processed foods. Easier said than done. 100%.
Absolutely. Yeah. Yeah. Especially with, people's schedules and lives these days, costs, all those things can be
Right.
really difficult.
Soccer practice, school, all of those things. You're kind of just grabbing what you can in the car. Here's an energy drink. Here's a bar. Here's and I know I'm guilty of it too. I'll get really busy with my day and it'll be 2 o'clock. I'm like, oh my gosh, I don't think I've eaten,
Yeah.
And it's another thing with neurodivergency. I know a lot of ADHD people, we get so busy and hyper focused that we all of a sudden will realize it's been 7 hours and we haven't eaten.
Right.
So,
right.
those are things to pay attention to too in your kids.
Yeah, I really admire the work of Ellen Satter. And I love to think about that, for us as parents, one of our roles is to help our kiddos develop and establish a really positive relationship with food, right? And so this idea of like no foods are forbidden, making room for moderation, and that division of responsibility, I really resonated with what Maya shared.
Talk a little bit more about that piece around moderation and what you would say to parents and families as they, prepare to shape their children's meals and meal times.
Yeah, I mean, I think moderation means something different to everyone, right? So it's hard to say, oh, just, eat the Takis in moderation. There are different ways to think about it. And for me, I kind of think about that my plate image and those core messages around like we want to make half of our plate fruits and vegetables, and we want to make sure that we're getting whole grains every day. And so as long as we're hitting kind of those benchmarks, then that leaves a little wiggle room for some of the other, maybe less nutritious snacks, the salty snacks and the sweet treats, etc. But we really want to avoid those power struggles and sort of setting up this idea that certain foods are off limits. I think that just makes us, want them even more, make our kids want them even more.
I found I have a 7-month-old now, and we've just started transitioning to solids. And so like thinking about how to set her on a good path and my own life experience around trying to, have a healthier relationship with food and, an image and all of these things. I feel like the biggest thing I've taken out of that is the knowledge that I feel like I didn't necessarily get as a kid. And so understanding like, okay, what is this vegetable? Like, is it a carb? Is it a protein? Is it a fat? Like, how do all these things kind of fit together? And you mentioned the My Plate, kind of piece. I think there's a great opportunity to educate if you feel you're lost on this yourself, learning this and learning it alongside your kids and teaching it. But if you're also an expert in it, great. I wasn't. But being able to sit down with your kids and kind of explain like, well, what is a Taki? Like what's in a Taki? It's a carb, it's a fat, or like, what is it? And how does that fit into this idea of My Plate and, and kind of balancing out your nutrition.
And that Takis, although being bright red, do not count as a colorful food on your plate. Yeah, that's not, I know. Raspberries, yes. Takis, no.
But Maya also brought up a really important point about engaging kids in the process. I think kids really enjoy being decision makers and kind of, having that role. And so it can be anything from helping to plan the meals or perhaps shopping, taking them shopping and picking out the foods. Maybe they see a new vegetable that they didn't know about that they might be interested in trying. So I really like this idea of getting kids involved. I think that can, help them get more buy-in for the foods that you're serving at home.
Dr. Kilmer, I'd love to hear from you, how poor sleep and poor nutrition just really exacerbate the likelihood of substance use and how those things really kind of come together to be worst case scenarios.
That's a great question. I feel badly that I have nothing to bring to the Taki conversation.
Be glad. Be very glad.
To the people who have nutritional expertise. I kind of want to ask, we can all agree kale is off the table, right? No one should eat.
I love
no
kale.
one should eat kale.
I had kale yesterday.
just an opinion. But to your question, I do think we have data on the number of people that even say, I intentionally use substances as a sleep aid. And there are so many things that are going to be effective sleep aids that won't have the side effects attached, the addiction potential, the strings attached, you name it. And it does become a bit of a vicious cycle. Amy made reference to this earlier, that someone stays up late, they've been using something, their quality of sleep isn't great. The next day, they're really, really dragging. And then they're like, well, I can't fall asleep. If they continue to keep using in this way, it does become problematic. Amy also mentioned, something we need to be mindful of if people are getting to the point where they're using where it's risk for a substance use disorder. what sometimes people refer to as, in quotes, being addicted. One of the symptoms of withdrawal can in fact be insomnia or having a really tough time with sleep. And so someone might say, I tried not to use, I couldn't sleep at all. See, it's helping my sleep. And it's like, well, no, it's not that it's helping your sleep. It's that if people finally cave in and use, they're making withdrawal symptoms stop. And their subjective sense might be, look, it helped me fall asleep. It really does become something you need to keep your fingers on the pulse of in terms of looking at how interrelated those really can be.
And lack of sleep also leads to, impulsivity, mood shifts, mood swings, poor decision making. It's really hard to be calm or have, forethought or anything if you're lacking sleep.
It's hard to do anything. I mean, again, I'm a new parent and I've just gone 7 months without sleep. And I was like, who am I as a human? Like, I'm not like, I was like, where did I go? And now that I've gotten a little bit more sleep, I'm like, oh, here. But it's the foundation of so much. And again, both sleep and nutrition are signs to be looking out for when there's changes in your child. So you have a child who was sleeping and now is not sleeping. They're at risk for either substance use or they may be using substances. It's not a guarantee. So the message here isn't, oh, just assume that your child is using substances. Same thing if you're a child now, their nutrition habits have eaten, they have less of an appetite, more of an appetite. That may be a signal that they might be using substances. It could be a sign that they're at risk of using substances. Again, it doesn't mean that they are, but there are things to take seriously and investigate. And we talk so much about the connection and the conversation with your kids and being able to maybe, like I noticed, like you don't seem as hungry as often. Like is something kind of going on? Because these are signals for potentially, I talk to the young people that I work with as calling them like check engine light is kind of going off.
Yeah.
And so the check engine light's going off. You're not eating enough. You're eating too, or maybe not too much, but you're not eating what you used to. You're sleeping more than you used to. What's going on? Let's check in.
Yeah. Sleep has always been kind of a struggle in my house. We have tried all sorts of things in the house, and sometimes it's just not easy. Sometimes it's just really, somebody has a really hard time getting into that sleep-wake pattern. So, if you're a parent out there and you're struggling with it, you're not failing. If your kid is in middle school and they're not sleeping, welcome. Like, it's all of those things are, I just want to reassure parents that those things are like, they're difficult and we're all dealing with them. So don't think you're failing. You're doing a great job.
There's one thing that I would add from the nutrition and substance use perspective is sometimes when we see kids who are increasing their substance use and decreasing their intake, we start to see some malnutrition arise, and we also start to see them drop off their growth curve. And so when that kind of starts to present, then we really want to take steps to refeed and replete while addressing the substance use and the sleep. But that's definitely something that we have seen in kids, and mostly teens that we're working with, because the substances really do displace the desire for solid foods or eating in general. And so there's a significant dip in calories. And also, depending on the substance, sometimes we see an increase in intake, and then they tend to want more of the hand to mouth snacks, the things that are the refined carbohydrates, the added sugars. And then that can fuel kind of a pattern of, and I don't want to be too negative, but like getting that metabolic dysfunction fire started.
I'm not a scientist, certainly not a nutritionist, but in my experience or my knowledge of working with young people who might be living with eating disorders, who of course are malnourished, the brain is not getting sufficient nutrition. And so being able to kind of make decisions, kind of proceed with logic, it just can't happen because the body is trying to preserve all of the other kind of, organ systems.
Yeah, absolutely. So when working with kids who have eating disorders, the first thing that I will say is that if a child presents with an eating disorder, I have found, and I'm not basing this in research, but this is just my clinical experience, that there tends to be a cluster in the school, which is very interesting. And I've even worked in some places where the schools are aware of this, and they will actually come and say, we see something happening, we're looking for support in this area. So that's one thing that I, often say to parents to just kind of be aware of, kind of what's happening around the culture of eating in the friend group. That's one thing.
Just like peer pressure with any substance use, it can, that idea of fitting in and wanting community, whether it be, with food or with restricting food or whatever it might be.
Absolutely. And you're totally right when you say that, when the brain is malnourished, that it's so much harder to engage in executive functioning skills. Like the brain is one of our largest organs and it loves carbohydrates. It needs it to function at top tier. It also needs polyphenols. It needs all the vitamins and minerals from the fruits, the vegetables, the whole grains, the herbs, the spices. And when someone does not nourish their body, the body kind of goes into a protective mechanism and will decide what it wants to work on. So, for people who are assigned female at birth, maybe they're going to stop having a period because it's not necessary. And if they are, in a starvation state, the body's like, I don't need to do that. So, we start to see that shift happening. So, yeah, 100%. It can be a challenge.
Speaking of challenges, one of the things that I would also like to address is that, for some communities, limited access to fresh fruits and vegetables. There are food deserts where there, are not any access to fresh vegetables, grocery stores, and it's a lot of carbohydrates, processed foods, sugary drinks, things like that. How can we help families that might be struggling?
From what we say is a couple of things. We eat what we have access to, right? And if someone lives in a marginalized community that is underfunded, you're right, they're going to have excessive access to the added sugars, fats, and salts. There are ways for people to become informed consumers. It takes emotional bandwidth. It takes some emotional flexibility to be able to say, listen, I'm going to actually read this package and make the best choice possible. It's hard when folks are trying to make ends meet. And especially if people are really experiencing food insecurity, it becomes a challenge. What I usually say to my patients is do the best, try to incorporate a culturally relevant fruit or vegetable in your pattern of eating at least once per day. And start to think about, well, what are the frozen, boxed, jarred, canned items that I can include in my cart that are minimal in terms of their added sugars, fats, and salts? And where and when possible, eat in community, because that can be so wonderful. And I know that that's not necessarily like a nutrition thing, but it is like a heart and soul thing. And we all need that. And give yourself grace because food is expensive right now. You don't have to eat organic, but fruits, vegetables, whole and ancient grains, herbs and spices should be at the center of our plate.
I think those are fabulous suggestions. And I think that also, for families who are looking for resources in their community, your child's pediatrician can be a great resource. There's often nutritionists on staff at, pediatric offices that might know of, and in the community I live in, you can get free fruits and vegetables at certain kind of locations and things like that. So those might be the people who kind of hold that information, as well as your child's school in terms of, and also I think for sleep too, like if your child is struggling with sleep and you're not really sure where to turn, your child's pediatrician can be such a wealth of knowledge around what resources might exist and what's kind of healthy versus unhealthy and when does somebody else need to intervene.
You're listening to Awkward Conversations. Thanks for being here.
Saving lives means staying informed. Knowing the dangers of using fake prescription pills can help those you care about and keep our community safe. As a parent, educator, neighbor, or friend, we all play a role in building safe and healthy futures for ourselves and our loved ones. Do your part to take the first step today. Visit GetSmartAboutDrugs.com to access education, prevention, and treatment resources. Fake prescription pills laced with fentanyl are deadly. Be their protector. Be informed. Visit GetSmartAboutDrugs.com.
Welcome back. You're watching Awkward Conversations.
So, I'm hearing a lot from young people and their families about the supplements that are available to them nutritionally these days. And, the things that they hear about online, social media saying, get this supplement, you'll feel so much better, you'll be bigger, stronger, whatever kind of it may be. What are you seeing in regard to supplements and what is your message to families about how to keep their kids safe, in this world of what's good for you and what's not?
Yeah, social media is a minefield right now. Like TikTok, Instagram, YouTube, like all of the misinformation and disinformation specifically around what supplements are acceptable to take for kids, the dosing and where they're purchasing them. It's unbelievable because there's so much access with, shipping from any place. This often we tell parents that they should be having real conversations with their kids about what they're hearing in terms of supplements. And from my perspective, I actually say no supplements whatsoever. And if a kid is going to supplement, it should be based on a laboratory test, something that they're actually missing, or if they have a pattern of eating, let's say they're a vegan and they're engaged in wrestling 7 times a week, then we're going to start to talk about supplementation. But for the pediatric population, absolutely not. And I definitely say do not listen to people who are online saying this worked for me because that's anecdotal. There's no scientific evidence. It hasn't been third party tested. It's simply unsafe. And this is just an open conversation about the dangers of engaging because we also don't know what's in those supplements. They haven't been tested and they can have all sorts of heavy metals, but also more than what's on that nutrition facts label.
It's often the case, or it can be the case, that folks online are being paid, by companies to, market
Absolutely.
these things. So what we used to know as an ad, because we'd see it on TV, sometimes looks like, oh, it's just like something I did and it worked for me. So it's, it's being
Right.
careful about those messages
Yeah.
of overall.
And there are a lot of celebrities out there and people who kind of don't have qualms about, promoting something that may or may not be scientifically proven. So
Or that they've even used.
right. So, it's also back to that conversation of communication with your kids, reminding them that influencers are there to influence you, not to help you.
And it sounds like having that conversation with a healthcare provider can be really helpful. Again, there's so many nuances to what young people may need. You mentioned laboratory testing, blood work, kind of driving whether or not somebody needs some additional kind of, aid of some kind. And so, engaging with those healthcare providers is essential.
I think there's also space for the role of schools and through health education. And we would love to see more schools doing more health education to empower kids to be able to navigate all of this misinformation and really understand, how to make the best choices, whether it's around food, but also how do you access accurate information about supplements that are available.
I'd also imagine, school nurses being potentially, a resource to families as well.
And oftentimes there are actual health offices and health clinics at different schools. I know my younger daughter goes to a school that has a health clinic attached, and all families are able to go and access all of the services there. And it's really, really helpful. So those things do exist, and definitely make sure to check those out.
Definitely.
Caitlin, you were talking about the role of schools in helping to facilitate, discussions and about nutrition, about sleep, about how to really take care of yourself. What do you see in the work that you do with schools that has been really helpful or effective for their students and families?
So the work that we do is helping schools identify those evidence-based policies and practices that can really support healthy eating. And so there are a lot of things in the nutrition space that schools can do, and also a lot of ways that parents can engage with the schools to support healthy eating. So in the space of school nutrition, some things that we see are, we talked a little bit earlier about the cafeteria being a really chaotic place for a lot of kids. And so, how do you make that cafeteria environment more pleasant? And how do you ensure that kids actually have enough time to eat their meal? And we talk about things like making sure that the school has policies in place around school celebrations and rewards and fundraisers that support good health. So that could mean a lot of different things. We don't always have to sell sort of less nutritious foods for a fundraiser. We can do fundraisers that actually incorporate physical activity and support health in other ways. We have a whole range of resources for parents to help them get engaged in this process. So to connect with schools and to work for positive changes in the schools related to nutrition and physical activity.
Now, schools can be a huge support, but of course, parents and caregivers are the number one support systems of ensuring healthy sleep hygiene and nutrition. What can parents do, particularly with their young people, to help support better sleep, nutrition habits, bed, things like that?
And it's so stressful. Like, are there ways that parents can do that without adding an additional burden or stress to them? Maybe it's
Right?
magic bullet question.
Right. Yeah. Are you
but it's
wrestling
so
the phone
hard
out of your
already.
children's hand?
So much of the research shows how important a schedule is. and having a set bedtime and a set wake up time. Because then bedtime's not being negotiated every night. There's something predictable about that. But that, so much of the behavioral work that looks at sleep looks at the role of conditioning. And, for some of the works with college students, we can almost predict who's going to report having sleep problems if they study on their bed, for example. Because if you're studying on your bed, you're pairing your bed with stress, worry, and schoolwork. If they start getting tired, maybe they have an energy drink, and now you're adding stimulants to what you're pairing all of this with. You asked about things like what you're doing with screens. Screens in and of themselves, I think that, there's research that looks at content can matter as well. It's, yes, there's the light, but it's like, are you watching something super intense and then turning the lights off? Or are you playing a video game that's super intense and then turn the lights off? So I know some of the best practices say if you have a set bedtime, about an hour where you're kind of winding down. And when you're sleepy, you go to bed, and you can get to the point where that sleepiness becomes more predictable with a predictable schedule.
I've also heard that if someone's trying to fall, or if someone's having trouble with sleep, and they focusing on the time they wake up sometimes and being really consistent about the time they wake up can sometimes help reset that kind of going to bed time over and over, as hard as it is to get up when you're really tired. But that sometimes also is the thing to focus on. If you can't focus on both, start at wake up time and then build in.
If we know that two people have over 3 nights, 24 hours total of sleep, we know nothing. It could be that one person went 8 hours, 8 hours, 8 hours. Another person went 10 hours, 2 hours, 12 hours. And the 888 person's going to probably feel a lot better and a lot different than the person. But even the 888, was it, 10 p.m. to 6 a.m., 10 p.m. to 6 a.m., 10 a.m. to 6 p.m., or was it 10 p.m. to 6 a.m., 1 in the morning till 9? The 8 hours alone, you said it perfectly. It's that routine. It's that set wake up time. Really does get to the point then that you're awake when you're supposed to be awake, and people will start, everything else will kind of fall into place in terms of getting sleepy and being able to sleep when it's time to sleep.
The last thing I'll add too in my work that I've learned can be helpful is having that, the weekends are such a, a time for young people to be like, why do I have to be up? I get it. I don't want to be up at the same time on the weekends. But if you're having trouble with sleep, then also, again, having that wake time still be the same on the weekend. Even if you get up and then you fall back asleep, like in 30 minutes or an hour, that your body at least gets that message that like the time to wake up is this time. And those naps and things like that maybe aren't always the most beneficial. But again, if you're trying to get back on track, that can be another thing that people can keep in mind. You talked a little bit about devices and screens and phones. Should they be in their bedroom? Should they be kept out of their bedroom or things like that?
I mean, I think you could do an entire dedicated hour on something just like that topic with people for whom it's, that age group that they work with. Again, primarily I work with college students, and we do know that their parents, caregivers, and guardians are still very influential as well, though. And so more than anything, if they're worried about, saw a glowing light through the bottom of the door until about 2 a.m, like, you need to sleep. You tell me you're tired all the time. So it's having the conversation, it's communicating, if there's stuff you need to talk about, I'm here. The more you can have that communication open, that doesn't go away when they go to college. That becomes important as well, even once they've left for school.
And you can check kind of like the phone settings too, to see like how much of you're using the phone and what hours they're using it, to kind of check, overnight, is this becoming kind of a problem?
An over-the-counter medication can sometimes be just as addictive and problematic as illicit substances.
I think it's a really important conversation to have with a healthcare provider, because even if someone says, well, this isn't like a prescription medication, it's over the counter, know if there are people for whom there might be reasons to not be using that. Are there any warnings? But even other things that make people sleepy. So many of the over-the-counter things that help you sleep are allergy medications. They have the active ingredient is an antihistamine. And so if someone's already taking an allergy medication, maybe adding something at night, if people don't realize that that's adding up on an antihistamine, could make the person even more drowsy. If they're of the age where they're driving, that becomes pretty dangerous, because that can impact their ability to stay awake, things like that. So if it is an over-the-counter thing, have that open conversation about, I'm thinking of buying blank. To what degree is that a good fit for me or not a good fit for me or my kid? Or I have bought blank. Good call. What should I do with this? And just the more they can consult with someone that knows them and knows them best, the better. Especially if they're then reporting use of substances beyond medications. If they're drinking, if they're using cannabis, if they're using other substances, it's looking at ways in which those could even cause drug interactions as well.
And one thing is, as someone who has experience in recovery and things like that, and with abusive substances, keep an eye out if your kids are keeping NyQuil in their room, keeping DayQuil in their room, whether it be in pill or liquid form. The liquid forms have very high alcohol contents. And if you drink much more than the prescribed amount, it will have like an illicit intoxication and an illicit substance-like effect. So, even if it's Benadryl, you can take more Benadryl than prescribed, caffeine pills, all of those sorts of things that I think parents would be like, oh, well, they're just, maybe they're just tired. They popped a caffeine pill, but look out. If you find 3 or 4 empty bottles in your child's room, they could be using that as, a fill-in for illicit substances that they can't get their hands on as easily.
We've said it before on the show, and I think it bears repeating here again, of course, like being able to set the expectation with your child that anytime they're taking a medication over the counter or prescribed, they should be having a discussion with you about that so that you're aware of what they're taking so you can kind of safeguard them. And, again, like you mentioned, Dr. Kilmer, so many of these medications have side effects that you don't know how they're going to interact with other medications you may be taking or conditions that somebody may have. So it's a good idea to say, if you're taking it and putting it in your body, I want you to make me aware of it. And we should be having a conversation before you initiate or start taking anything.
Even if you think it's safe. I mean,
even a vitamin or, again, whatever it may be.
Anything like that. We talk about making sure that kids are safe all the time. So keep medications locked up, even if you think it's just melatonin or it's just Benadryl. Be mindful of the age of your kids and what they might be looking for, because I know I've seen that plenty.
And I'll just add, if as a parent or caregiver, someone's like, I really don't want my kid using blank, communicate that. There's research that shows that when kids are like, I feel like my parent would be okay if I did this, they're more likely to use it. And when they say, I know my parent doesn't want me doing this, they're less likely to do it. That's true with sophomores in high school. That's true with college students. When they think my parent, caregiver, or guardian's okay with me doing this, they're more likely to engage in it. So if there's not that approval, to communicate that clearly, they're listening. It will land. It'll make a difference.
What you permit, you promote, which means what you don't permit, you don't promote. The opposite is true. I think those are wonderful, suggestions, Dr. Kilmer. Similarly, on the nutrition front, I would love to hear from, you, Caitlin, and from Maya around what are some practical strategies that parents can use to try to help, promote, again, not promote, there's the word again, healthy nutritional habits.
From my perspective, we talked about some of them already in terms of engaging kids in the process of meal preparation. But I also think it's important for parents to, it's okay to start small. We're not looking to make a change, like a big change overnight. We can do small things that over time really make an important difference. So, for example, we could swap a sugary drink for water instead, or we could add a fruit or a vegetable, a serving of a fruit or a vegetable every day, and that over time makes a really important difference. So I think, small changes over time are really important to consider.
I found just putting a water dispenser in my house, I suddenly, 40 some plus years, I don't think I drank enough water. But now I notice my kids go to it because it's right there and it's easy. Just like you said, small changes like that, where it's just about having the access or the ease of access.
You're also talking, though, again, about something we talk about a ton, which is modeling behavior. Right. And so, like, I know my husband, he hates vegetables. And so, like,
mine.
With the baby, he's committed to trying all the same foods that she's going to try.
Do you have to feed him too with the little airplane?
Not yet. But that might be coming soon, especially Brussels sprouts. But, like being able to, it's to not eat meals throughout the day and expect your child to eat meals throughout the day, for you to be, maybe drinking sugary high, high concentrated beverages, and then saying you shouldn't have that. Those are kind of, I think, confusing messages for kids. And so as much as you can, implement yourself doing these, healthy habits or engaging in them, the more likely your kid might be to say, hey, I'm going to try it too. Or
I feel like you're really looking at me for that one. No,
no shame, no blame. Right? No shame, no blame.
But it's true, and also knowing that, like, holidays, sometimes the increase in sugar, or birthdays, you're going to, maybe you ate 2 pieces of cake. And talking about modeling, I know everyone deals with body image issues, but also I think pulling apart the idea of thinness and how you look with what nutrition is and what being well, nourished means. And that looks different for everybody. And also, teaching your kids to kind of ride the waves of it. Sometimes maybe we're having pizza and cake because it's somebody's birthday. And then, okay, next week now we're going to eat some more salads.
Some kale, Dr. Kilmer's favorite.
Some kale.
I also think that one of the things that's important is to start from a young age. Because, when you're thinking about building that culture of well-being in a family, early modeling. And then I also think as the kids grow up and move through the life stages, consistency, the same way that we want to be consistent with sleep and open conversation is the same way that we want to be consistent with meals.
I think, what you just said was so important, Maya, and what you just talked about, Jodie, around like the body image piece is so important too. We have a whole episode on body image in one of our previous seasons. So if folks are interested in hearing more about that, I'd encourage them to go back and listen. I think it's really important though for us to note that the comorbidity between substance use disorders and eating disorders is actually the highest of any conditions. And so again, like if you're concerned about your child's relationship to food and nutrition, that early intervention we talk so much about, talking to your children's healthcare providers, is essential, because that overlap is immense, and it can be immense, and something to, not, we talked, about not having the not my kid mentality in some of our other episodes, take it seriously.
Yeah,
I would encourage folks to take it seriously.
Well, this has been such an incredible conversation. I just want to thank you all for joining us. I mean, we have covered so much, and sleep and nutrition are the foundations of hopefully raising happy, healthy, well-adjusted, and substance-free young people and adults. I could go eat a salad right now for sure. But no, I just want to thank you all for joining us and give you one last opportunity to list out any resources or your website if you have one, or anything that you would like to leave our parents with, so that we can leave those websites and information in the show notes for all of our viewers and listeners. Caitlin, why don't we start with you?
Sure. I'll give a plug for our Parents for Healthy Schools resources, and I can follow up with the link so that everyone's able to access those online.
Great.
Dr. Kilmer?
I just want to thank you for the chance to participate today. Jodie, you mentioned the work you do to support and promote folks in recovery. That's so important. And that's one of the things, at least on college campuses, we're seeing be one of the fastest growing groups of people. So from the bottom of my heart, thank you for the work you're doing around that area. And rather than put any one website or resource out there, I just think certainly good things happen when people have those conversations. And when in doubt, given some of the topics, including healthcare providers in those conversations. Thank you.
Maya?
I'm thrilled to be here and have been in conversation with everyone. And I agree with Dr. Kilmer. I really think that believing in science, trusting in the research is something that I want to champion. And I encourage parents to continue to reach out to their pediatricians, their dietitians, their dentists, their therapists, their psychologists, their psychiatrists, and believe in the research that we have done, the schooling that we've all had, and know that we have your children's best interest at heart.
Science.
Yay, science. And Maya, where can we find more information about you?
My practice is virtual. We're based in New York, but we see people across the country, and we're actually credentialed and can take health insurance. And I've got a team of dietitians who really believe in patient-centered care and work from this lens of cultural humility, meaning that we believe in the lived experience of our kids and their families and anyone that comes through our screens or doors. And we know the science, and then we marry it and bring it together. Your listeners can find me at mayafellernutrition.com.
Nutritionists, I find, are such an underutilized resource. And I think, you don't need to necessarily be struggling in order to reach out to get information from a nutritionist. I've learned so much from nutritionists. I just want to put in some plugs for all the nutritionists
for real,
and the dietitians out there.
Just learning to swap like the high sugar stuff for stuff that maybe doesn't have the high fructose corn syrup or the, a little bit added fiber. Super helpful. But all of those resources, again, will be listed in our show notes for the parents and listeners. We will have all of that for you, because I know that there is a lot of information and studies out there that can really help. So thank you again so much for joining us. We really appreciate you. Thanks again for coming. And everyone out there, if you're listening or you're watching, we will be back next week. And remember, keep those conversations happening. Thanks for joining us. We'll be back soon with Awkward Conversations. Every day, dozens of people with flashy effects, catchy music, and even explosions are making their way into your home, whispering into your kid's ear that it's okay to make bad choices. And to you, they're strangers, but to your kids, they're intimate friends.
The two places that you have to insist that your kids are not on their screens are in their bedrooms and at meal times.
That's hard.
That the more empathetic a kid is, the less likely they're going to be influenced by celebrity culture. All you have to do is sit down with them and just watch a video they're into and say, well, what do you like about this? What do you think this person is experiencing? What would you do in that situation? The more you get the empathy muscle growing, the more protected they're going to be when you're not around, which is what you want. it's really the parent that has the most influence. So I think that's really great we're having this conversation, because I think we can really empower parents to do something about their kids who are on their screens all day long.
This is such an exciting tool to think about to help build that, that individualization developmentally for teens.
Kids are at an age developmentally where they're trying to figure out their identity. And there's a celebrity on there feeding that as well.
Oftentimes celebrities are singers or actors, or they have, creative outlet, but influencers, really, that is, it's in the job title. They're there to influence people on social media.
It's less about I want to do what that influencer is telling me to do, more I want to be an influencer myself. I can do that myself.
Dr. Cooper, thank you so much for joining us today. This has been such a great conversation about really, parenting the child that you have and having those conversations.
Make sure to check out getsmartaboutdrugs.com. Parents, caregivers, you can find so many resources of great information there about how to talk to your kids and make these conversations a little less awkward. A huge thank you to the Elks DAP, which is the largest all-volunteer nationwide drug awareness program, and also a huge thanks to the DEA for their outreach program and for making this possible.
The views, information, or opinions expressed during the Awkward Conversation series are solely those of the individuals, speakers, commentators, experts, and/or hosts involved, and do not necessarily reflect nor represent those of the production, associates, or broadcaster, or any of its employees. Production is not responsible and does not verify for accuracy any of the information contained in the series available for viewing. The primary purpose of this series is to educate and inform. This series does not constitute medical or other professional advice or services. This series is available for private, non-commercial use only. The production, broadcaster, or its channel cannot be held accountable for all or any views expressed during this program.